Good morning, ladies and gentlemen. The topic of today's lecture is the nutritional deficiencies and their impact on skin. So it's an interesting topic and will help you in deciding which multivitamins to prescribe in which indication. So let's proceed. Nutrition. Nutrition is defined as the process by which a living organism assimilates food or other nutrients and use them for life and for the maintenance of their health. Adequate nutrition is required for the maintenance of well-being and in prevention and treatment of disease. These are the facts we all know. Who are the persons which are at risk for inadequate nutritional intake? Infants and elderly who are usually dependent on others for their nutritional intake. Impoverished and neglected individuals. Chronic alcoholics. Patients on pure vegetarian diets. Persons on parenteral nutrition. Those with eating disorders or unusual dietary habits, and the persons who are suffering from hypercatabolic states, such as metastatic cancer or severe chronic illness, for example, HIV. Abnormal absorption in patients with gastrointestinal diseases, such as celiac disease, or inflammatory bowel diseases. Those patients who have undergone some gastrointestinal surgery. Patients who have received prolonged antibiotic therapy. There are causes in which there is improper utilization due to hepatic disease or drug-nutrient interaction. Then there are genetic and metabolic defects or enzyme deficiencies, which usually present early in the life, not later. So these are all the causes why we get a nutritional deficiency in an individual. Malnutrition. Malnutrition is a term that is used to define an imbalance between the intake of necessary nutrients and psychological need and physiological needs. Protein energy malnutrition is characterized by imbalance between protein and carbohydrates. There are two phenotypic forms of protein allergy malnutrition, and they are Kwashiorkor and marasmus. Acute malnutrition is described as the malnutrition that is less than 3 months old. And chronic malnutrition is the malnutrition which is more than 3 months old. Kwashiorkor and marasmus. Kwashiorkor is disproportionate intake of carbohydrates in excess of other micronutrients, especially proteins. So there is a tendency to ingest more carbohydrates like cereals, like wheat grains, rice, and less proteins, which are mainly seen in milk, egg, and meat. This results in hypoproteinemia, growth retardation, and most notably edema. In marasmus, there is a globally decreased intake of all macronutrients that includes carbohydrates, proteins, and fat. And by definition, marasmus patients show growth retardation, but do not demonstrate hypoproteinemia specifically or edema. This is a picture of Kwashiorkor. It is due to deficiency of proteins more than carbohydrates. The food sources which are missed include fish, meat, egg, milk, peas, and cereals. Manifest in children from 1 to 5 years and characterized by retarded growth, pot belly, and swollen limbs due to edema. This is a picture of marasmic child. The nutritional deficiencies include protein, carbohydrates, and fat. And the sources which are missed include fish, meat, egg, milk, peas, and cereals. The symptoms are thin limb, weak appearance, enlarged head, loss of weight, and retarded physical and mental growth. Causes of protein energy malnutrition. Switching of milk-based formulas to rice beverages. Hypermetabolic or catabolic states associated with inflammatory or infectious diseases. In patients with chronic liver disease, AIDS, or those undergoing dialysis. Decreased absorption of protein from GI disorders such as inflammatory bowel disease, protein-losing enteropathies seen in SLE, cystic fibrosis or following bariatric surgery, and decreased synthesis of protein due to underlying metabolic disorder. So the first reason, that is switching of milk-based beverages to rice, is the common cause in young children. Then the hypermetabolic states, chronic liver disease, decreased absorption from GI disorders, they are all acquired causes. Then there are causes of decreased protein absorption due to underlying metabolic disorders which are seen in metabolic diseases manifest early in the age. Monitoring malnutrition. So the most easy way to monitor malnutrition in children is weight for height Z-score. While in adults, we do BMI and serum albumin levels, which are usually high in protein energy malnutrition. The treatment is gradual replenishment of nutrients and associated electrolytes, and treatment of infections. Now we are going to discuss the most important aspect of this lecture, that is the vitamins and the deficiency diseases associated with deficiency of particular vitamins. First is vitamin A, and in the picture you can see that vitamin A source are meat, fish, then carrots, papaya, broccoli, apricot, peaches, melon, avocado, pepper, mangoes, egg and cheese, sweet potatoes. Deficiency of vitamin A results in cirrhosis, xerophthalmia, keratomalacia, bitot spots, nyctalopia, that is decreased vision in dim light. Bitot spots are the keratinous spots seen on the sclera. Reduction in tear secretion. Diarrhea and kidney stone. So among these deficiency diseases, you can see that the main brunt of vitamin A deficiency is on the eye, resulting in dryness and many other effects. Then in addition, it causes dryness of the body, diarrhea and kidney stones. Causes of vitamin A deficiency is number 1, inadequate dietary intake, fat malabsorption, chronic intestinal inflammation and liver diseases. Management. The recommended daily intake of vitamin E is 1,000 to 5,000 international units. And for treatment of deficiency diseases, we have to give vitamin A around 5,000 to 200,000 international units daily. Now, I have mentioned the names of some common vitamins which we use in our day-to-day practice. I could not use the generic because the vitamins usually don't have any generic name and they are mixture of different vitamins. So excuse me for using some brand names, but these brand names will help you in understanding that which brand contain which vitamin and in what quantity. So AMAX drops are a very commonly prescribed vitamin A drops, which we give to infants and young children. And just remember that each drop of AMAX contains 2,666 international units. So if we give 10 drops in a child, then we will be giving 26,660 international unit to that child. So in case of vitamin A deficiency disease in young children, we can give 10 drops of AMAX in the morning as well as in the evening, mixed in water, milk, or any other beverage. Then vitamin A toxicity, which is called as carotenemia or keratinoderma. This is an acute overdose or chronic excessive intake due to intake of non-prescription nutritional supplement. Carotenemia is due to increased consumption of beta-carotene, which escape conversion to retinol and absorbed as carotene from the intestine, mainly the carrots and other vegetables, seen in hypothyroidism, in pancreatic and liver disease. Carotenemia are characterized by yellow-orange pigmentation of face, palm, and soles. Complication is liver cirrhosis. Color and symptoms resolve after stopping excessive intake. Then a very essential vitamin, a vitamin which is now coming up as a very important vitamin in many skin disorders. It is vitamin D. Body itself makes vitamin D when it is exposed to sun. In addition, you can get vitamin D2 from cheese, butter, margarine, fortified milk, fish, fortified cereals, and food sources of vitamin D. Vitamin D causes absorption of dietary calcium and reabsorption from kidney and bones. Vitamin D2 is derived from the diet, and D3 is prepared endogenously after exposure to ultraviolet light. The deficiency of vitamin D results in hypocalcemia that lead to stimulation of parathormone and release of bone calcium and all the resultant effects like fracture and bowing of bones and pain in the bones on walking. So deficiency of vitamin D or calciferol results in rickets and osteomalacia. It disturbs calcium and phosphorus absorption. The only major effect of vitamin D deficiency on skin is alopecia. Management. Without sun exposure, you need 800 to 1,000 international units of vitamin D daily. Supplement with 50,000 international units of vitamin D2 weekly for 8 weeks is effective. So Sunny D capsule, which is one of the commonly prescribed vitamin D supplement, contains cholecalciferol, that is vitamin D3, in a dose of 200,000 international units. Then another important vitamin, that is vitamin C. And vitamin C is mainly replenished through the fresh fruits and vegetables. The fruits include the citrus fruit, green pepper, strawberries, tomato, broccoli, sweet and white potatoes. So vitamin C is not replenished from poultry, from meat, from milk, and hence the fresh green leafy vegetables, citrus fruit, and tomatoes are the only source. Deficiency is due to decreased intake or increased loss. It is commonly seen in elderly, in alcoholics, in parenteral nutrition, in food fetists, in paraplegics, or those individuals who are dependent on other for their food. Increased vitamin C requirement is seen in tobacco smoking and in renal failure. Scurvy is the disease that results from vitamin C deficiency. It develops 1 to 3 months after vitamin C deficient diet. So body has a store of vitamin C that is sufficient for maximum 3 months. Patients generally complain of lethargy, fatigue, malaise, emotional lability, easy bleeding, bruising, and poor wound healing. There is hemorrhagic gingivitis, as you can see in the picture, loosening of teeth and teeth loss. On skin, it manifests as phyreneoderma, corkscrew hairs, perifollicular hemorrhages, purpura, splinter hemorrhages in nail, and edema of the legs. You can see the purpura, you can see the follicular hemorrhages. Hemorrhage is also seen intramuscular, intra-articular, and subperiosteal. Bowing of long bones and swelling of costochondral junctions also occur. Diagnosis and management. Level of vitamin C is usually below 11 micromoles per liter in scurvy. The daily requirement of vitamin C is 40 to 120 milligrams. And scurvy is usually treated by 100 to 300 milligrams of vitamin C till the symptoms remit. And most of the vitamin C containing tablets, which are available as lozenges, contain 500 milligrams of vitamin C. Then comes vitamin E. Vitamin E is an important antioxidant which we find in almonds, in pine nuts, in pepper, in papaya, green olives, sunflower seeds, avocado, and cold pressed plant oils. Deficiency of vitamin E does not cause any cutaneous manifestation. This deficiency is rare in humans, but if occur, it can cause neurological and muscular sequelae, premature babies, sterility in experimental animals, coronary heart disease, and the antioxidant effect help protect body from damages by free radicals, which are generated by cigarette, air pollution, and ultraviolet light. This is the reason we prescribe vitamin E as anti-aging. Management. Recommended daily intake is 4 to 15 milligram, 800 to 1200 milligram if ataxia occur due to vitamin E deficiency. Usually the vitamin E containing capsules available in market contain vitamin E in a dose of 400 milligram. So if we are treating deficiency, we have to give it twice a day. Then vitamin K. Vitamin K has varied sources that include egg and meat, fish oil, strawberries, spinach, asparagus, broccoli, beans, and soya beans. Dietary intake accounts for 50% of vitamin K, while rest of the 50% is produced by bacterial synthesis in the gut. So all the diseases that are affecting the bacteria in the gut will result in vitamin K deficiency as well. The effects of vitamin K deficiency are defect in blood coagulation, hemorrhagic manifestations, lack of prothrombin, so there is increase in prothrombin time, and loss of excessive blood even from small wounds. Bleeding and easy bruising are the initial symptom. Epistaxis, gingival bleeding, GI and genitourinary tract bleeding is common. Deficiency is treated by intramuscular injection of vitamin K, 5 to 10 milligram. Then comes the vitamin B complex, and the first vitamin we are going to discuss in vitamin B complex is vitamin B1, which is also known as the thiamine. Thiamine is found in fortified bread and in cereal, fortified cereals, in fish, in meat, and in milk. The deficiency disease due to thiamine or B1 is called as the beriberi. And there are two types of beriberi, the wet beriberi or dry beriberi. Wet beriberi affect the CVS mainly, and dry beriberi cause neurological manifestation and affect CNS. So the symptoms in wet beriberi are cardiovascular, that include cardiomegaly, congestive cardiac failure, hypertension, and peripheral edema with red burning tongue. While dry beriberi is associated with neurological symptoms that include peripheral neuropathy, ataxia, nystagmus, and aphonia. Along with this, there are GI effects like vomiting, diarrhea, and loss of appetite. Daily requirement of thiamine is 0.5 milligram per 1000 kilocalories. So it is usually treated by 50 to 100 milligram of thiamine per day for 7 to 14 days. A common brand of vitamin, that is Optilate M, which is cheap as well, contains 10 milligram of thiamine. So if we have to give 50 or 100 milligram thiamine, you have to find thiamine from some vitamin company capsule that contains only thiamine. Then another important vitamin B, which is vitamin B2, also called as the riboflavin. Riboflavin has almost a similar source as B1, that is milk, fortified cereals, and meat. Along with that, green leafy vegetables. Deficiency of riboflavin result in ORO-OCULO-GENITAL syndrome. So this vitamin is a coenzyme function in tissue respiration. And clinical deficiency manifests as photophobia, seborrheic eczema-like eruption around the nose, eyes, ear, and genitalia. That's why it is called as ORO-OCULO-GENITAL syndrome. Acute deficiency is due to borate ingestion, and chronic deficiency is due to deficient diet. It presents as deep red erythema, photophobia, epidermal necrolysis, and mucositis, angular cheilitis, glossitis, and cheilitis. Management. Recommended daily intake of vitamin B2 is 0.3 to 1.6 milligram. Treatment of deficiency is done by 10 to 20 milligram daily. Serbex-Z, a common brand, contains 15 mg and Optilate M contains 5 mg. So one tablet of Serbex-Z or Optilate M is usually sufficient to counter the riboflavin deficiency. Then comes vitamin B3, also known as the niacin. Again, the source of niacin is similar to B1 and B2, that is milk, egg, fish, meat, and some nuts. Only half is from the diet, and rest of the niacin is from amino acid tryptophan endogenously. Pellagra is the disease that results from deficiency of niacin or vitamin B3. There are three manifestations of pellagra: dermatitis, diarrhea, and dementia. So we are concerned with the dermatitis, which is described as painful and pruritic erythema in photo-exposed areas. Vesicle and bully may also occur. Later, the rash becomes fixed, hyperpigmented, and keratotic. Main areas involved are the dorsum of hands, the malar area, neck, called as the castle necklace, then angular stomatitis, cheilitis, and glossitis. See the different manifestations of pellagra, mainly affecting the hands and feet, with clear demarcation from the photo-exposed to non-photo-exposed areas, and typically associated with a V-shaped rash on the neck called as the castle necklace. Then, in addition to dermatitis, it is associated with diarrhea and have abdominal symptoms that includes the abdominal pain, anorexia, nausea, and vomiting. Then neurological features include, which come late, they include headache, anxiety, fatigue, insomnia, depression, and impaired memory. Management: your daily recommended intake of niacin is 13 to 20 milligram a day, and treatment is by 500 milligram daily. Neurological symptoms improve in 1 to 2 days, but skin lesions require weeks to remit. 500 milligram of niacin is not present in any multivitamin. So you have to find a capsule that contains 500 milligram niacin from some vitamin company. The next vitamin B is the vitamin B5, also known as pantothenic acid. It is so widespread in food that deficiency is unlikely, and deficiency is seen only in individuals on semi-synthetic diets. And the symptoms of pantothenic acid deficiency include fatigue, irritability, sleep disturbance, abdominal distress, and neurological symptoms such as tingling in hands and feet, called as the burning feet syndrome. Then comes vitamin B6 or pyridoxine. Vitamin B6 source is also similar to B1, B2, and B3. That is fortified bread, cereals, nuts, egg, fish, meat, but not in milk. The only difference is that less milk. The causes of vitamin B6 deficiency include decreased intake, malabsorption, or medications such as isoniazid, which we give in as anti-TB medicine, and hence we give vitamin B6 as a measure to prevent its deficiency whenever we give ATT. Other drugs causing deficiency of vitamin B6 include hydralazine, penicillamine, and contraceptives. The deficiency is also seen in alcoholics. Then deficiency of vitamin B6. Deficiency of vitamin B6, like pantothenic acid, result in seborrheic dermatitis like eruption, and angular fissures, cheilitis, and stomatitis. Also causes microcytic anemia, convulsions, and irritability. Management. The daily requirement is 0.1 to 2 milligram. Deficiency is treated by 100 milligram daily. And vitamin B6 tablet, which is available in the market, which we give in as an anti-TT with anti-TT treatment, is contain 50 milligram of vitamin B6. Then comes a very fashionable vitamin nowadays, that is biotin. Biotin is also known as vitamin H or vitamin B7. The deficiency of biotin is rare and may be observed in people who regularly eat large quantities of raw egg white, which contain a glycoprotein avidin that binds biotin and prevent its absorption. Long-term use of certain anticonvulsant drugs may also impair biotin absorption. Symptoms of deficiency include skin rash, hair loss, and eventually neurological abnormalities. So as is written in the slide, the deficiency of biotin is rare, but it is quite fashionable in writing biotin to people who are suffering from hair loss. Then comes a very important vitamin, which is folic acid. Folic acid is also known as vitamin B9. Folic acid or folate is clearly related, has closely related function with vitamin B12, notably participation in DNA synthesis. Deficiency shows symptoms as weakness and fatigue due to megaloblastic anemia, disruption of cell division along the GI tract resulting in persistent diarrhea. The inadequate intake of vitamin in early pregnancy may cause neural tube defect in fetus. That is the rationale of giving folic acid to pregnant ladies. Methotrexate interferes with folic acid absorption, metabolism, and hence causing side effects like hair loss and diarrhea. So we counter this effect by giving 1 tablet of folic acid along with methotrexate per week. If we give it more, then the effect of methotrexate is compromised. Deficiency of folic acid also results from heavy use of alcohol that interferes with its absorption. Then comes another important vitamin B, which is vitamin B12. Vitamin B12 source is milk, egg, and meat, just like other vitamin B complex vitamins. In addition, it is also seen in fortified grains such as cereals. After ingestion, gastric acid and intrinsic factor help in its absorption. So the deficiency of intrinsic factor results in deficiency of B12. And the effects of B12 deficiency are similar to the effects due to folate deficiency. But it takes 3 to 6 years for the deficiency effects to appear. Deficiency of B12 cobalamin results in pernicious anemia, which is a megaloblastic anemia, mucocutaneous features like angular cheilitis, glossitis, hair depigmentation, and body pigmentation. Neurological problems include subacute combined degeneration of cord, ataxia, paresthesias, and weakness. Management. The daily allowance of B12 is 0.4 to 2.8 microgram. Deficiency is countered by 1 milligram injection monthly or methicobalt tablets, which contain 500 microgram of B12 given daily. Optilate M tablet contains 6 microgram and Serbex Z 12 microgram. Iron. Now we are dealing with some essential micronutrients and metals. So the most essential is definitely iron. And the iron is acquired by red meat, from poultry, chicken, and from egg yolk. Then it is also obtained from oyster and shellfish, dry fruits, grains, legumes, lentils, and green leafy vegetables. Legumes are the phaliyan, which in Urdu, iron. Heme causes heme synthesis, collagen synthesis, and various oxidation reduction pathways. They are important in infants and women of childbearing age. So these are the category of people who suffer from iron deficiency. H. pylori is associated with iron deficiency and anemia. The main effects of iron deficiency is on nail become brittle and spoon-shaped, called as koilonychias. Mucous membranes cause effect of iron deficiency are atrophic papillae on the tongue, glossodynia, that is pain in the tongue, recurrent apathy, and angular stomatitis. Hairs are usually dry, brittle, with split ends. So iron is also an important supplement for dry and brittle hairs. Then anemia, cardiomyopathy, and cardiac failure also occur because of iron deficiency. The daily allowance of iron is 15 milligram a day, and deficiency, in case of deficiency, we give 1 to 2 milligram per kilogram per day. The most popular ibuprofen folic tablet contains 105 milligram of elemental iron, so it is sufficient to replenish the deficiency of vitamin of iron. Then comes another important metal, that is zinc. So the food which are rich in zinc include chicken, shrimps, cheese. Then the whole grain flour, wheat germ, sunflower seed, lentils, brown rice, carrots, spinach, and soya bean. Acquired deficiency of zinc occur in alcoholism, in anorexia nervosa, in vegetarianism, in total parenteral nutrition, inflammatory bowel disease, chronic diarrhea, pregnancy, malignancy, diuretics, and use of sodium valproate. Acrodermatitis enteropathica is an autosomal recessive disease that leads to mutation in zinc transport gene, resulting in zinc deficiency from the onset. The breastfed infants with acrodermatitis enteropathica present at the weaning when breast milk is stopped, while the formula-fed infants develop the signs and symptoms of acrodermatitis enteropathica in 4 to 10th week of their lives. This is because superior zinc absorption from human milk. Acrodermatitis enteropathica has a triad of presentation, which includes alopecia, diarrhea, and periorificial and acral eruptions. There is symmetrical eczematous rash with vesicles, bullae, and pustules, and crusting at edges. The rash is seen in oral area, but spares the lips, and also seen in perianal and periperineal areas. It causes delay wound healing, paronychia, and angular cheilitis. This is how a child of acrodermatitis enteropathica presents with periorificial dermatitis. There is crusting and vesiculation at the edge of the lesions. Investigation: there is low zinc level, less than 70 microgram per deciliter, but the sample is collected in the morning. Serum albumin is also low, and there is low alkaline phosphatase level. Management of acrodermatitis need a lifelong treatment with 3 milligram per kilogram per day of elemental zinc. Copper deficiency. Copper is a micronutrient and its deficiency results in metallic taste in the mouth, eye and skin yellowing, circulatory anemia and shock, vomiting, nausea, pain and burning, and kidney results in no urine production. Copper deficiency in skin result in hair, effects on hair, which become short, dry, lustreless, and white. Selenium is another important metal, and it is replenished from seafood, kidney, liver, fruits and vegetables contain little selenium. The deficiency results in compromised immune system, decreased ability to fight infection, risk of developing cancer, and Kishan disease, which is heart failure in young children and women of childbearing age. The recommended daily allowance is 55 microgram per day. So toxicity result in brittle hair and nail and GI upset and skin rash. The tarry nail is one of the manifestations of selenium deficiency. Selenium deficiency also causes in accelerating aging. So selenium is an important anti-aging micronutrient. This slide shows different medical or dietary causes and the resulting deficiency of the vitamins and micronutrients. So if there is history of blood loss due to menstruation or and in GI tract in post-menopausal women and men, the main deficiency results in iron deficiency. Different malabsorption disorders result in deficiency of different vitamins. Pregnancy mainly causes deficiency of iron, folic acid, and zinc. Alcoholism results in deficiency of folic acid, in zinc and niacin. Malignancy is associated with deficiency of iron, zinc, and depends upon the type of malignancy. Renal dysfunction result in deficiency of selenium and zinc. H2 blocker uses causes iron deficiency. Anti-epileptic cause biotin and zinc deficiency. Hypertensives again result in zinc deficiency. Prolonged antibiotic use causes biotin deficiency. Isoniazid cause niacin deficiency. Inadequate sun exposure cause vitamin D deficiency. And living in mountainous areas, China, Tibet, and Serbia result in selenium deficiency. The vegetarians results in iron and zinc deficiency. And excessive ingestion of raw wheat result in biotin deficiency. So this was actually a summary of whatever I told before. Now I have grouped some indications and the cause as far as the vitamins and nutrient deficiencies is concerned. So the vitamins that are essential in case of hair loss, they include iron, zinc, selenium, vitamin A, niacin, biotin, folic acid, vitamin D, omega fatty acid, and amino acids. So minded, biotin is not the only vitamin that is the cause of hair loss. There are many other vitamins that are also important. So it is better to give a product that contain a mixture of all these essential vitamins. Then the vitamins that are essential in treating premature graying of hairs. So premature graying of hairs occur because of B12 deficiency, because of iron deficiency, chronic protein loss, cobalt, calcium, vitamin D3, smoking, and ultraviolet light. So stopping of smoking and stopping of exposure to sunlight in addition to giving the above mentioned vitamins. Vitamins is also necessary for treatment of vitiligo. Since the drugs that are used for vitiligo are limited. So it is essential that you add an appropriate vitamin that helps in patient of vitiligo. So vitiligo improves by giving folic acid, by giving B12, by giving vitamin C, vitamin A, and beta carotenes. There is a brand name which is tablet called as Vitex that contains vitamin C, vitamin E, folic acid, and B12, and minerals such as selenium, copper, and zinc. So this is an important product that helps in treating the vitiligo patients. Then here in this slide, I mentioned a few common skin diseases and the vitamins whose deficiency or whose replenishment help in improving the clinical appearance. Psoriasis, vitamin D, omega-3 fatty acid, and vitamin A. Also check obesity and stop alcoholism. Alopecia areata, vitamin D should be given. Lichen planus, B complex, vitamin D, aloe vera, and probiotics. Atopic dermatitis, vitamin A and vitamin D. And autoimmune diseases, vitamin D. So you can see that vitamin D is common in all these diseases. So vitamin D has become a very important vitamin to be given in skin disease of almost any indication, of any type. Then a very common manifestation of B complex deficiency is an angular cheilitis occurring at the corner of mouth, and it should be distinguished from angular stomatitis of riboflavin deficiency. In angular stomatitis due to riboflavin deficiency, the angles are heaped up with sodden or wet appearance, and glossitis is also present, while in angular cheilitis, there is just the fissures at the angle or corners of the mouth. Aphthous ulcers is a very common occurrence. They are small, well-circumscribed, shallow ulcers that occur in lining of mucosa of oral cavity in otherwise healthy patients. Patient may relate it to the onset of menses, trauma, stress, and food allergies. And among the deficient vitamins, B12 and folic acid are important. These are the aphthous ulcers. Burning mouth syndrome. It is also one of the common findings which we see in middle-aged or older individuals, mainly female. Tongue is the common side. However, burning of the lips, gums, and palate may also occur. In addition to causes like diabetes and candidiasis, B12, folate, and iron deficiency may cause this problem. I thank you all for a patient listening, and I hope this lecture would have made you conversant with common vitamins and the diseases or deficiencies resulting in their resulting from it, their deficiency, and how to replenish them. Thank you all, and hope to see you next week for another edition of my lectures. Good day and goodbye.